Hi everyone, I'm Dr. Shikha Garg. Hit the like button. We'll start with the series of vaccinations. So first we'll discuss about HPV vaccine. So what does HPV causes? It is a virus, human papilloma virus. The lower risk, it has very much variants, but the more common 6 and 11, they can cause genital wart. It's a low risk virus. The other variant 16 and 18, they are high risk. They can cause cancers like cervical cancer, vulvar cancer, vaginal cancer, throat cancers, penile cancers, and anal cancers. The best part about this is there is a prevention with the vaccination. So what is the best age to give vaccination is 9 to 14 years, when that adolescents, they are not exposed to sexual activity. It needs 2 doses, 0 and 6 months apart. In adults 15 to 45 years of age, it has been recommended to take 3 doses, 0, 2 and 6 months apart, because then it can prevent from the virus. So in adults 3 doses are needed, 0 months, 2 months and 6 months apart. So it will prevent from the viral variants which you are not exposed to. It is not 100% preventable at that age group. It is recommended for both male and females. The best part about vaccine, it is very good tolerated. It is only a small schedule, 2 or 3 doses as per the age group. It is very effective. It's like 99% effective and the highly recommended vaccine. And the best part about it is now it has been added into our national vaccination schedule. So children which are of that age, now they can get it for free of cost. Adults who are not of that age, you should all get vaccinated. Highly recommended. The vaccine has all the variants which are needed for the prevention. We are discussing HPV vaccination. So I'll tell you the brand names available. The brand name Cervarix or Gardasil 4 has 4 variants, 6, 11, 16, 18, which are more common. Now latest vaccine has 9 kind of variants covered. It's called Gardasil 9. These are all available. You can directly talk to your doctor for the pediatric age group, or for the adults they can give you vaccination directly into the arm. It's a simple small intramuscular injection. Very safe vaccine, very effective vaccine, and it is a must recommended for both males and females. In females, even if you are not in the pregnancy or lactation, but even if you have children, it is still recommended to take that vaccination. Not recommended during pregnancy and during lactation. In the series of discussing vaccines, today we'll discuss adult vaccine related to shingles. So what exactly is shingles? It's a chickenpox virus, varicella zoster virus, which causes chickenpox in the pediatric age group more commonly, or even in adults. And everybody knows chickenpox in adults is very dangerous because there are more complications. It does not get resolved that easily. It always leaves some complicated situation. So if you had chickenpox in your childhood, best thing. If you did not have a chickenpox in your childhood, please do get vaccinated for chickenpox if you are like 30-40 years of age. 2 vaccine schedule is needed. So in patients who got that vaccination or chickenpox, there could be a disease called shingles when you are above 50 years of age. So what would be the symptoms and how to prevent, we'll discuss. We are discussing shingles vaccine. So what is shingles? It's a reactivated form of chickenpox virus in adults and usually above 50 years of age. So risk factor are more patients with diabetes, with chronic kidney failure, patients with the HIV positive, or patients with heart disease. They are more at risk of it. So they should all get vaccinated for shingles. There are 2 kinds of vaccines available: live attenuated and inactivated viral form of vaccination. One needs 1 dose and otherwise 2 doses. So what exactly are the symptoms for the shingles? There would be blisters which are very painful, very having a stabbing or a burning sensation, malaise, fever, or the pustules filled with water. The problem with shingles is the post-herpetic neuralgias, which is severe pain in your nerves. That is a complication which can be difficult to bear. It's extreme pain, very severe pain. So you might need painkillers, but along with that you will need a treatment antiviral. Also you need to consult your doctors how to go about that. Other vaccinations for adults also includes influenza shot, which is supposed to be taken every year so that you can be prevented to get that
yearly infections, yearly viral infections, which are very frequent every year. Viruses tend to change their shape. It's called genetic drift. So that is the reason every time somebody is having viral, we are always prone to getting viral. Even if we had it earlier, still there is always a chance to get it again, because viral mutates in itself. Apart from that, the other vaccines which are needed are the tetanus, diphtheria, mumps, measles, rubella, and pertussis vaccines. Usually these are already included in the children's vaccination schedule, but certain age group, if you are not vaccinated earlier, please do get vaccinated for this. Apart from that, there are certain vaccines like meningococcal vaccine, which is more or less for people who can get exposed, who are working in the healthcare industry, they need those, and people who are immunocompromised or above 60 years of age. Shingles vaccine we already discussed. Flu vaccine, either for the influenza or general flu shots, every year should be taken so that you are safe for 1 year to from the general flus. Apart from that, in pregnancy, of course, tetanus is needed, given to the females. And adult vaccine, others are if you're traveling outside, specifically in Africa, yellow fever vaccine is needed. Apart from that, you can see whatever country you're visiting, according to their laws, there are certain kind of vaccination available. And in adults also, hepatitis B is very important. If you were already vaccinated for hepatitis B, go get your anti-HBs titers checked. If they are less than 10, please get the booster dose. It's really important to prevent you from hepatitis B. Apart from that, Hib vaccine can be taken, that is Haemophilus influenzae type B type, only to those people who are working in the healthcare or who are exposed to those disease. Otherwise, we usually do not prefer it. For in the diabetic patients, pneumococcal vaccine is very important. That is really important. Those people with heart disease, cardiovascular disease, again pneumococcal vaccine is important. Those people who are immunocompromised in terms of HIV infection, those people need vaccination for hepatitis A, B, meningococcal vaccine, pneumococcal vaccine, shingle vaccine. Although these are all needed only when the CD4 count has to be checked. If it is very less, we do not recommend any vaccine, because those viruses will get activated and will cause the disease. So you have to be careful in those people. Always consult your doctor before getting vaccinated, even in adults, even in children. Those people who are having liver disease, we prefer giving hepatitis A, hepatitis B, and pneumococcal vaccine. For the lung disease, COPD, asthma, all those, pneumococcal vaccine again. In those people with end-stage renal disease or kidney disease, hepatitis B and pneumococcal vaccine. Apart from that, obviously, if you never had chickenpox, get vaccinated for the chickenpox. Females, we already discussed HPV. Males also need HPV vaccines. Apart from that, hepatitis B vaccine, if your titers are less than 10, please go get your titers checked. You can get MMR vaccines if it is needed, and Tdap according to the titers and according to the schedule which you have already followed earlier. Thank you.